Welcome to Your Pharmacy Career Podcast, proudly produced by Ravens Recruitment, the experts in pharmacy career and locum services for over 30 years. Every episode is your gateway to new opportunities in the pharmacy profession. From expert advice to inspiring success stories, we're here to spark ideas, guide your career, and help you achieve your goals. Stay tuned. The next step in your pharmacy journey starts here.
Welcome back to Your Pharmacy Career Podcast. I'm your host, Christy Lee Patterson, and today's episode is a little different from our usual conversations. We're joined again by Nancy El-Miski, registered pharmacist and in-house pharmacist at SparrowHub, for a follow-up conversation. But this time we're not necessarily talking about career milestones. We're talking about something almost every pharmacist will face and very few of us are trained for. And that topic is grief. Now, Nancy chose this topic herself, and by the end of this episode, I think it'll make sense to you as to why this is an important topic to talk about, especially in relationship to a pharmacy career. So, Nancy, welcome back to the podcast.
Thank you for having me. And yeah, this topic is a little different, but I think is just as important.
Absolutely. So Nancy, with the topic of grief for today's episode, it's not something that most pharmacists would probably lead with or even connect to something that is related to their pharmacy career. What made you feel that this was an important topic to bring into this conversation?
Well, yeah, grief is definitely sometimes not a comfortable topic. And I think that's exactly why we need to talk about it, because we tend to shy away from it because we don't know how to deal with it sometimes when we're faced with it. But in reality, we all probably will experience grief at some point in our lives. And as healthcare professionals, we have people walking through our doors every single day who are dealing with a new diagnosis or caring for someone they love or trying to hold it all together while their world falls apart because of someone that has just passed away. So to be honest, grief is all around us in pharmacy, whether we recognize it or not. And for me personally, it all started because of my own grief, because of losing my dad. And through my journey, I started wanting to understand the stages of grief. And by doing that, I began to see my patients completely different. It gave me more patience, it gave me more empathy, and more importantly, it actually gave me a better approach to my day-to-day care. So yeah, I started to see myself asking better questions, wanting to help them through my scope of practice as a pharmacist, how can I educate? What access can I provide for them? What services can I offer to ease their journey and their family's journey? Because when I felt it through my dad and the journey we went through, I knew, this was an important topic to do.
Absolutely. And to be honest, I just think it's so brave of you to do this, because not only is it a topic that is important to you and it's affected your life as a health professional, but also personal. And it's very difficult to talk about things that we hold so close to us. But the other thing with this story is this has been with you your whole pharmacy career. You were around 21 or 22 years old when you were first accepted into pharmacy school. And that should be a really great time to celebrate with your family that you've been that you're going to university, accepted into pharmacy school. But then your family was actually hit with some news a couple of months later. Did you want to touch on what that news was?
Yeah, exactly. So, from the previous episode, my dad was the one that really wanted me to do pharmacy school, and was so happy that I got in and we were going down that journey. But then a few months into pharmacy school, my dad was diagnosed with metastatic bladder cancer. And it felt like the carpet was pulled out from under us because we weren't expecting it, of course. And then, of course, all the questions start to appear, like, what does this mean? How long is dad going to be here? What can we do? And so the journey started with, going through surgery, radiation, then chemotherapy. But what was the hardest part was watching someone who was so strong, who was funny, who's your whole life, become weaker and more withdrawn due to the treatment, due to the diagnosis. And that's when I realized grief can start there. And the reason grief can start there is that you start to grieve what was, who that person was, the life that you had previously. You know, like I said, I was Daddy's little girl at that time where anything was possible, everything was, you know, amazing. And then this hits our family, and it hit us hard because, especially with my dad, he was one of the pillars, the big pillars of our foundation. And one of those, and when that pillar falls or gets weakened, the whole environment changes. So the way that we ran the household, the dynamics of the family, what we talked about, what we didn't talk about, it starts you start to grieve all of that. But after a year of treatment, he went into remission. He felt this enormous relief, but you always have this constant worry. You know, how long is it going to last? When's it going to come back? So for 4 years passed, and I finished internship, became a pharmacist, got offered a management role. We celebrated, but then the cancer came back. It had spread everywhere. Chemotherapy was no longer an option, and palliative care was the only path. And it was around Christmas time when they told us that he had a month to live.
Oh, wow. That's huge.
Yeah.
And I just want to touch on that time frame because I know that doctors don't like giving time frames. It's something they avoid to do. So to get that just would have been devastating.
Yes, it definitely was. And I remember myself, I was in denial. I was very much saying, no, that's fine. We'll take him home and I will take care of him and I will feed him and make sure that he puts on that weight. And, you know, you go through every single, I was very much in denial. But, you know, we had to make it work. You know, you can't just, accept that outcome. And I could see my dad, he had accepted it. And you could see that he was just letting it go. And I was like, no, we've got this. We can do this. You know, we hired out all the equipment we needed to make it comfortable for him at home. And it was just really, really devastating time. It was actually the worst time of my life, to be honest. And so we set up 24-hour care at home. We had the palliative care nurses coming in daily, which they were amazing. They just were amazing. They kept me calm. They helped me through the process. But through navigating morphine injections, midazolam injections, and my family relying on me to do all of that because I was the pharmacist, I was like that healthcare professional. But at the same time, I was his daughter. And so it was really hard for me to have both hats sometimes where I just wanted to sit there with my dad and just be there as his daughter and enjoy the moments that we had. But I had to also be that pharmacist. And that's where I realized, like, when I was going through that healthcare side of everything and the injections, and I'd call the pharmacy and I'd get them to order me morphine when I needed it and the right strength that I needed and the midazolam and all of these injections and anything that I needed. And I knew when to talk to the doctors and how for them to write the S8 scripts correctly and just navigating the health system. I knew how to do that. But then it hit me and I said, how does someone else that doesn't have my background, doesn't have any of this knowledge, be able to deal with this in such an urgent and devastating time with their family? That just changed for me the minute that happened.
That's actually such a really important point, and I'm just now reflecting on some of the pharmacies that I've worked at throughout my career, and some of them did have those type of medications ready to go. Generally the ones that serviced aged care homes, they had that stock there ready to go. But then, I'm sure there's been times when people have presented with prescriptions for these type of medications and we've had to order them in, and of course it always happens on a weekend or after order cutoff time. And then you're in a rural area, next thing you know, our next order won't get here till Tuesday and it's Saturday. And you're right. For everyone else that's not part of the healthcare system, or even if they are to a certain extent, like they shouldn't have to be worrying about that. As you said, you're a healthcare professional, but also a daughter, and you just want to be not worrying about those things. So I'm sure this has impacted your career and your thoughts on stocking these type of medications and supporting people in this process. Did that change for you?
Yeah, definitely. Like after losing Dad, I threw myself back into work, and in reality, it was the way for me to grieve. I was completely in denial.
Why does this not surprise me after getting to know you a little bit?
Exactly. So my work was an escape for me because I think it was stable, and I knew I needed to go in, do my job, be there for my patients, my staff, and it felt I had control there. But when I was at home dealing with my own thoughts, that's where grief really takes you. And it's that alone time that, that's why when you see people, you might think, oh, wow, they're so strong and they're so together. But really, sometimes when you don't know what's behind the curtain, or when they're home alone thinking about all the things that have just happened, it really, you see a different side. So work for me was my escape, which was good, but then was bad because it catches up with you later. So I felt all the stages of grief collided in one big hit for me. It was like a roller coaster, really. I remember when patients came in with palliative care scripts, I would be, oh my God, this again. And I would run to the patient and be like, I'm here for you. I know what you're going to go through. I know there's going to be a lot of things that you need to deal with. And what do you need? And I just felt like it was a duty of care at that time, where I needed to support someone that's just gone through what I'm going through. I've got to help them through this and help them navigate through it easier way. And that's when I said, okay, well, let's do this in a proper way. And so I approached and called the palliative care clinic that was across the road from us in the pharmacy. And I said, what do you need? What are the main medications? What are the, even the over-the-counter products, from the bicarb mouthwashes to any of the compounding medications? So like with chemotherapy, they can get itchy skin, and so doctors prescribe certain compounding. And because we were a 24-hour pharmacy, it just made sense for us to be the one to stock all that was necessary in regards to an urgent matter such as palliative care. And so I started to go down that road and start, making sure that we had all the supplies that were necessary.
I also didn't think about the non-SA medication. When you think palliative care medication, you think to midazolam, morphine, those type of medications, and danzatron. But there's so much more to palliative care, which, is really important. And it's just as important to make sure those things are in stock, because they're not drugs of addiction. The family or the patients are probably thinking, oh yeah, I can just grab this. And you can't just grab it.
Exactly. And you want to make sure that, you get everything the doctor wants, because it's really important. They don't know. So from the juice boxes that, they needed, to formula that they need to, because they can't eat properly, to mouthwashes, to creams, whatever necessary. At least if you didn't have it, at least know where to refer someone to, not just, sorry, we don't have it, see you later. That's the difference that I wanted to make and I always try to make with any service I implement, was we need to know the knowledge of everything, where we can at least refer them if we don't have it.
Yeah, it's very important. And it's frustrating that there's not just one database. Maybe there is, and I don't know about it. Maybe with AI that might help a little bit now, helping us to understand. But I think, maybe reaching out to your local palliative care team could maybe be a great place to start. You were lucky to have it in such close proximity, but there is one in each government area. So maybe that's just a good starting point, and asking them for that advice.
Exactly. Exactly. And then train your team on it and make sure that everybody is around understanding the journey. Because that was something that we did because we were a day and night pharmacy, anyone could come at any time. So, they bring in a script or they had a concern about anything. And so I found that I needed to make sure that my pharmacist and the team knew what palliative care was, because before my dad, the whole journey, I didn't know really what palliative care was. I knew it could happen in a certain place, but what really is happening there? And
it's mainly just what people see on TV, right? In medical dramas.
Exactly. Exactly. So some people do palliative care in a centre or a hospital, and some people do palliative care at home. So, you need to know that. You need to know, and by understanding the knowledge and being equipped with understanding what the journey is for someone going through palliative care and what the journey is for the family, then you can help people easily. And so I felt that by teaching the pharmacist and the team, it really gave them a space to really understand the stages of grief they go through. You have more, they started to have more patience. They gave more space differently. You don't rush. You stop rushing someone who's already overwhelmed. So you really know how to serve the customer better when you understand the journey they're going through and the issues that they're going through as a pharmacist.
Good point around that sense of urgency and having that patience. And like, I know the pharmacy you're at, it was a very busy pharmacy. So it's difficult to manage that balance, but it's a good reminder.
Yeah, no, definitely. Like, it doesn't stop, because what I wanted the pharmacist to see is, well, if you see it's a script, that's a palliative care script and it's an essay, and maybe it's written incorrectly. Don't make sure that, this person's already exhausted and tired that's coming to you with this. They've got grief happening. And then if you stand there, there's something wrong with this, you've just got to say, you've got to word it differently to make them not feel any more anxiety, to sort of solve the issue really quickly and urgently for them, as quick as you can, and get that medication out. So that was I wanted them to understand that that's the urgency we need to be at, especially when it comes to a palliative care patient and their carers. So it can be as simple as fixing an essay script, but in the right manner, less anxiety, get it delivered, do payment over the phone if necessary, whatever necessary, you just get it done.
Yeah, exactly. One thing I was just thinking of during this time where you were dealing with this grief and you've received this news, you just started this new management position, which as a young pharmacist, that's hard enough managing people. Because I found that when I was in my first management position, you almost become like a quasi counsellor to a lot of the staff. And this is the thing, you never know what everyone else is dealing with, but when they're at home. And so for you would have had to put on that brave face and support your team. But what are some of the things that you did well, or maybe not so well, reflecting back, and to manage your team and to be able to be at your best to help your team?
Yeah, I think they went, I would say they saw there were different times and different.
Like, did you tell your team? Like, did they know?
No, they knew. Yeah, they knew after, and they knew in depth. And I wanted them to know, because after I saw what had happened, I wanted to make sure that they knew and understood what palliative care is and what someone with a treatment of cancer and then I found out from other staff that, their family members, did suffer from a type of cancer and they've gone through grief, or they're going through that process. And it helps to open up those conversations. And I think because I was vulnerable, It allows your team to be vulnerable as well and open up to you. And it actually let me be more empathetic and understanding. So when they were just having a bad day or they just didn't feel like coming into work that day because of a certain situation, no problems. It didn't cross my mind, because you start to see everybody as a human being. It's not a process of, this is work, you have to be here. And yeah, we all have to work, yes, but we also have personal lives and we also have personal issues. And we do have to deal with them in a manner that is correct. So yeah, I think my vulnerability to my team allowed them to see a different side to me. A lot of times they always thought I had it all together.
Yes.
I didn't feel that. They were a great support, and I do appreciate the team that I had. And I think when people feel or know your vulnerabilities, they start to understand you as a person and are more empathetic as well. So you start to have a really empathetic, understanding team that's willing to hold each other. So if I wasn't at my best, they would put in 110%. And if they weren't at their best, I'd put in 110%. So we could balance the day out. And, we knew how to lean on each other, because especially being a 24-hour pharmacy, day and night, we had to be empathetic and understanding to each other, because we couldn't be robots. We couldn't be, my job is done. We always would stay behind when there was a shift change. We'd always stay behind to get the other guys or the other team into place, ready to go. We didn't complain that, I stayed 10, 15 minutes or 20 minutes behind. It just didn't matter, because they were in a rush. Patients were waiting, so we were concerned about patient waiting, the pharmacist drowning, and we didn't want that stress to continue on because it will escalate later. So, yeah, I think it brought us together.
Mm-hmm.
Yeah.
I think that's really wonderful. And I'm a big advocate of showing some vulnerability as a team leader or manager, or even just as a pharmacist. Some pharmacists will say, I'm not a manager, I'm just a pharmacist. But even if you don't have the title, a pharmacist, you are a manager. Pharmacy assistants look up to you, the juniors look up to you, students look up to you, dispense techs look up to you. So I think it is great when you've got a culture in a team where you can share some of those vulnerabilities. And exactly to your point of being able to carry your team member through when they're not at 100%, I think is really nice to be able to say to your team, look, today I'm coming in, but I'm not 100%. And you're like, okay, well, you know what? But you're able to communicate that, which I think is a very nice way to work together. Because I remember when I first started my first job, the culture was very much, you leave your problems at the door when you come in. Now we know that that's just physically impossible.
That's so true. That's so true.
Pharmacy Daily is a proud supporter of your pharmacy career podcast. If you're in the pharmacy world, it's a great resource to stay up to date with the latest industry news. To subscribe, just head to pharmacydaily.com.au to get the newsletter delivered straight to your inbox.
It's not truly a workplace, because you spend probably more time in your workplace than you do in your own home. So they become like your family. And if you're not understanding with each other, and it's not going to work. You feel it even as a patient walking into that pharmacy. You will feel the dynamics of the team, that everyone's just looking out for themselves, or it's, very much not connected in the farm, and patients can feel that.
Mm. Oh, they sure can. Even I know when I've walked into pharmacies or any type of retail environment or business, you can tell it's in the air if it's not 100% and the team not working together. You can tell.
Yeah. And even that empathy comes across with, I wasn't shy to talk to my patients about my journey either. So, there were days where they'd look at me and go, Nancy, are you okay? And I'm like, no. And I would just start crying, and I would get hugs from my customers, and it's okay. I realized it was okay to cry with my customers and with anyone, because that was part of my journey of grieving. And I remember I would even tell, there was a young girl that came through, and the doctor had prescribed sort of antidepressants, and she was quite young because her grandmother, I think, passed away. And I just explained to her that, it's okay to cry. It's okay to feel these feelings. It's okay to go through these emotions. And, she started to cry, and I gave her that space. But it's really important to let people know that it's okay. It's okay to be vulnerable. It's okay to be, to go through the grief stages. It's okay. You want to cry? You want to be angry? You want to be upset? You want to isolate? You want to go through all the journey? That's fine. It's fine. It's not. A lot of people think it's like a type of depression, but it's not. It's not. It's more just a journey that you need to go through.
Absolutely. And, grief can be applied beyond just palliative care as well. I've got a memory in my mind that just stuck out to me when you were talking about a patient crying with you. And the situation was where I was providing advice and support to a patient that was getting MS two-step. So if you're not aware of what that medication is, it's also called the abortion pill. And it was interesting because even in the pharmacy I was working at, there was some discussion as to which pharmacist would go and speak to her, because there was some pharmacists that didn't feel comfortable providing that medication, which is completely fine as well. And went and spoke to her in a private area and had a discussion with her about it. It turned out that it actually wasn't her choice. Unfortunately, she had a miscarriage. And it's not what she wanted to do. And I just said to her, "Are you okay?" And she said no. And I don't know what I said after that. Maybe I said it's okay to cry. I don't know. Maybe I started crying as well, because I start crying when I see people cry. And she just let it all out. And then afterwards, she's like, "Oh, thank you. I've just been holding that in for so long." And I'm like, that's okay. So yeah, not exactly the same situation, but thinking of giving the patients a space where they feel safe to be able to do that, and also giving them a safe spot to share with what's actually going on. And because sometimes you can get a script for a medication and you think it's for something, but it's actually for something else, or there's more to the story, which I think can quite happen a lot when you're getting scripts for palliative care, but even just scripts for other medications as well.
Exactly. And that's why asking them appropriate questions and the right questions to allow them to open up, just like what you did, and giving them that private space and giving her, letting her feel that it's okay to open up to me and it's okay to express what the real grief was, is really powerful and really part of our scope in pharmacy, because and that's the best way that we can actually counsel our patients. But if you went straight into counseling, you'd probably never know what exactly she was. You'd say, "This is how you take it, go for it, see you later, bye-bye, and here's a CMI." But when we actually, take the time to really understand a person and see them as a human being and really dive in, we get so much more. And I'm sure that lady was so appreciative of it and will probably come back to see you because of the space that you just opened for her.
And it also just got me thinking again as to how to approach counselling, because I know, especially when you're a student, you're trained to do these things so fast. And the minute that you see this medication, right, it's for X, Y, Z, I'm going to counsel this way, and then move on to the next thing. To your point about taking some patience and taking some time. And it sounds so ridiculous, but I had never even given thought as to what happens to women's children that have passed in utero and they've had miscarriages. It's got to go somewhere. I'd never considered this before. And so that's why she had to take this medication. So it just really got me thinking about, sometimes there's more to the story. And also the other thing too is, as you said, training your team as well, because that's also important, like when people are taking scripts or handing out medications and things like that. Is that something that you did with your team, like applying these principles to other services in the pharmacy?
Yeah, definitely. So when I started to see this whole approach, and like what you were just saying, we started to build services within the pharmacy with the patient in mind, not the pharmacy's comfort. Because I found that a lot of times when we build services, you hear the team saying, oh, we can't do it on so-and-so, we can't do this day, and so-and-so's not here. And then the service won't work. But when you think about the patient's journey from the diagnosis, so when we built sleep apnea, or when we built a diabetes service or a weight loss program, you think, okay, this patient's just been diagnosed with sleep apnea. Now their whole sleep journey is going to change. How are they feeling? What's the experience that they have when they walk into your pharmacy and show you that script for sleep apnea? You know, are they waiting? Are they pushed aside? Are they told to come back tomorrow? You know, what does the journey through your service feel like? Does it feel like you're connecting with the customer? Are you providing a complete solution for them? What does that even look like? So how we built services was asking the question of what is the patient's journey through from diagnosis, through what will happen through at home, as well as through our own service within the pharmacy, because you need to touch point on all the pain points that someone's going to feel to actually have a successful service. And then we saw the matter of urgency as well, because when someone's diagnosed with a diagnosis, it's urgent for them. They want to know information about it. Like when we knew the diagnosis of my dad, we wanted to know everything. What does he have to do? What do we have to do? What can we do now? You know, do we book this? People want to know. So if you have a service and people need to wait, or they walk into the pharmacy and because that one person is not there, no one can help them understand what they need to do, or no one can book them in to that service. I've seen it multiple times happen. And you think to yourself, you'd leave the pharmacy angry, upset, confused. And so, you know, when you don't respect a person's value and in the service, then you're dismissing it by, you know, and making it like slow and complicated or impersonal, you lose them. And more importantly, you lose the opportunity to help them. So I felt when a pharmacy got it right, the patient feels seen. They feel like someone actually is in their corner. The service moves at their pace, their need, not the pace of the pharmacy's convenience. So when it goes wrong, it usually because a service was built around what's easy for the store, and the patient feels that. So they feel like a transaction. And when someone comes to you in their moment of need and leaves feeling more alone than when they arrive, that's where we've got it completely wrong. So I think from learning from my grief and the whole journey, it made me apply it to pretty much any kind of diagnosis or any kind of change that someone would go through, and how we need to understand that journey and then apply it into our services by making it urgent, by giving them the right advice, by making sure the whole team understands why we have this service, where they can inform this person and how to run that service.
So important. And you're right. I've worked in pharmacies, but also just walked into pharmacies, just my local. And when that one person's not there, I was like, okay, well, can I book in for a flu vaccine? No one there knows how to do it. Like, what do you mean?
Exactly.
So I think you don't even if that person's not there, like we know staffing is hard, but just at least having the staff aware of what's available. Yeah. One of my pet hates is when it's like, do we do this? And they yell out, I don't know. Do we do this?
Exactly. Because it makes you lose trust and think, do they know what they're doing here?
Yes.
You know, and yeah, it's quite concerning.
Yes, or even just saying it in a different way. Like I know when, like I've worked as a locum, and so then it is hard. You don't know what is going on half the time. But I will generally just, so it doesn't look like I'm incompetent, I'll just say, look, this is my first day here. I'm still getting to understand everything, so I'm just going to get the right information for you. And wording it in that way is sometimes just enough to like, oh, okay, cool. So yeah, even if you don't know, just try and word it in a slightly different way.
Exactly. Like I became a locum after so many years, and yeah, in locuming, you don't know what the services are or anything like that, but it's really important. Like even if the pharmacy didn't have that service provided, I would probably either look it up and see where I could refer them to, or I would, through my knowledge of locuming and other pharmacies, what they do, I could at least refer them to another pharmacy. So it's always knowing that that person's not going to leave with me just saying, yeah, I don't know. I'm going to give them something to work on, like, yeah, so-and-so pharmacy do this, and so-and-so does this. I'll ask for this person, they can help you in that direction. I think us as pharmacists are one of the best, because we're usually the first one that most patients come to, and we're the best people to navigate to other places and refer to. We're the source of that knowledge. I find pharmacists are very resourceful in the fact of knowing where, like, it's really important that we educate ourselves of, yes, this is a podiatrist. Yes, you need to go this, and this is what the podiatrist does. An exercise physiologist, you need to know all of your healthcare professionals. You need to know sort of sending where one could be in your area for your customers, just to help them navigate the health system.
Absolutely. So, Nancy, I feel like this could almost be like a series in itself. Like there's so many things that we can unpack in all of these kind of subtopics of grief that we've talked about today. But before we wrap up, I just want to bring it back to the person that's listening to this podcast right now and is maybe they're listening to it on their lunch break and about to walk back into the pharmacy, or maybe they're listening to it on the way home and are going to be back on the counter again tomorrow. If that pharmacist is maybe carrying that grief or some grief, or maybe someone in their team, or maybe it's a patient, what is the one thing, or what advice do you have for that pharmacist that they can do, I guess, implement straight away?
Yeah, just start to notice it more by first going and learning what the stages of grief are, because grief doesn't always announce itself. It doesn't always, like, you can't see it, but the way you can see it is that regular customer or that staff member that you tend to know that comes in every morning and says, good morning, but maybe that morning they're not showing that sign, or for the last week they haven't been. That's a sign to sort of go, hey, I better check in on them, or ask Mrs. Smith, that's not, seems a bit more quieter today, how are you doing? Simple as, how are you doing? And really looking at them and genuinely caring and showing that, are you okay? Is everything okay? And that's enough for that person to feel seen, to feel maybe an opportunity to even start to open up and say, yeah, I'm not feeling my best, and that gives you then the opportunity to say, do you want to talk about it? If they don't want to talk about it, that's fine. Do you need time off? Do you need space? Do you, it allows you to then give them practical relief. And that comes down to staff or customers. A customer, I've seen it multiple times where a customer's just come out of hospital, or they've seen their doctor and their doctors have given them news, and they're just sitting on that chair more quieter than normal. And I've come to them and I can see it in their eyes that they're normally like, hey, Nancy, how you going? How's your day? They're just sitting there looking at me. And I'm like, hey, is everything okay? And then she'll say, actually, no, the doctor just told me this, and that, and I'm feeling overwhelmed, and I'm feeling like, or it could be for her husband, there's a new medication. And so that gives me then the opportunity to go, okay, well, is there anything I can help? Either through delivering some medication, or maybe Webster packing her husband's medication. Just finding a practical way within our scope of practice to make it easier on the person's journey. And by doing that, one, we're creating better rapport with our customers. We're creating that continuity of care for them. We're providing education. So these questions are really important, and engaging with our customers is really important. And like we were saying before, grief is not just the loss of somebody. It can come from anything. They even say, grief can be felt when you're going through a divorce, when your children have left you, you've raised children all this time and then your house is empty. You could have a lady coming in, sad because she's all alone at home now, and her children she's grieving the life she had before and now has to build this new life on her own and go through that process. So to be honest, we in pharmacy are dealing with a lot of grief from all our patients. And if we don't know how to deal with it, or we don't understand it, we're going to really struggle with connecting with our customers.
Yeah, that's so true. And I really like that point about grief isn't just related to death. It can be, as I said, relationship breakdowns, job changes. Like it's a response to something that's changing in your body. And that response, it doesn't differentiate between what the cause of that is. Like I have heard my husband actually talk about his divorce. So he's been married before. Some people might not know that about me. And he talks about the grief of losing his child. Like she didn't die, but she just all of a sudden wasn't with him every day anymore. And so that was something that he had to learn to deal with. So hearing everything that you've talked about, it's like, oh, that was actually probably a stage of grief that he had to get used to.
Exactly. And so when you know that, you will hold a bigger space for them and more understanding, because they're going to go through that grief and you'd be like, oh, why are they so angry? Or why can they not accept it? Or, that he can see her on the weekend or whatever it is, you can make an excuse, but it's a grieving process. And so when you start to know that, I wouldn't get upset with my patients if they were angry that day, or, they were impatient with us. And so it just makes it a lot easier. I remember one patient coming from the hospital. He wanted to return open insoles. So he bought them for his wife, but they were open and used. And he was adamant that we could return them. And so the first person he spoke to, he blasted them, everything like that. So when I came into the conversation, I said to them, okay, who are these for? And he's like, then he opened up and said, they're for my wife. She's in the hospital. She's sick. And then he started to break down. He was just angry at what was happening with his wife, not at the fact that we couldn't return the insoles or the foot care and everything in there. But we worked something out and we did something for him. But once he opened up and we understood, I had easier space for him. But we can become very like, oh, just kick him out of the store.
Yes. Oh my gosh. I probably have said that at some point.
But sometimes it's just, okay, let's bring this down. Let's calm the situation down. Let's see, is it truly the issue of the insoles and not being returned, or is there more to this story? So I think that's where what grief taught me is there's always something or a story behind, like the anger or the frustration or the being upset. And I love to always figure it out with patients. What is it?
That's beautiful. I love that. Well, Nancy, thank you so much for your time today and sharing your personal experience with this. I know it can't be an easy thing to bring up. No. And you've done very well to keep it together through this conversation.
But this is really the first time I've really opened up on, letting a lot of people know. Usually it's just people in my circle. So yeah, you've made me feel very comfortable today, and, being able to share it more. I think over the years I've been able to accept it more and understand it more. And I think it's important to share. And it's a healing journey for me as well. The more you talk about it, and like I was telling you at the beginning, I cried when I was thinking about this podcast and writing it down, and, thinking of how to present, and all the memories started to come back. And of course, it really took me back, but then I saw the strength in it as well. So that was amazing for me. So thank you for that.
Well, that's completely okay. And I feel so privileged to be in a position to be able to help you share that story, because I know that for those listening, I know it will leave an impact on each and every one of them. So Nancy, thank you again for appearing a second time. It's been lovely getting to know you more and more again. And is there any last words that you wanted to share before we go?
Just, always put the patient in mind, and remember, empathy is a very powerful tool to use, and it's one of our best tools in pharmacy. So be empathetic, be understanding, open space for your customers to open up, and you will just see things flourish. You will see them flourish. Yeah. And just know that there's always another side to the story with everybody. Everyone has some kind of personal journey they're going through.
Absolutely. Well, thank you, Nancy. It's been a very important conversation. Well, that's it for today's episode of the Your Pharmacy Career podcast. I do just want to let everyone know that if this episode has touched on anything difficult for any of our listeners, I'll put a link in the show notes to the Pharmacists Support Service. And again, if anyone has been touched by this and wants to reach out to Nancy, we'll have her LinkedIn details in the show notes. I'm sure she wouldn't mind people reaching out.
No problem at all.
Thank you so much, Nancy.
Thank you.
Thanks for tuning in to Your Pharmacy Career podcast, proudly sponsored by the Pharmaceutical Society of Australia. The PSA is committed to empowering pharmacists through advocacy, innovation, and industry-leading professional development. To become a member or learn more about how the PSA can support your career, visit www.psa.org.au. Don't forget to subscribe, share this podcast with your colleagues, and join us next time as we continue to explore your pharmacy career journey.